This is Todd Neal of MedPage Today, reporting from the American College of Cardiology meeting in Atlanta. Here, Dr. Douglas Packer of the Mayo Clinic in Minnesota presented the first findings from a large randomized trial of the Arctic Front cryoballoon ablation system for atrial fibrillation. I spoke with Dr. Packer about the results.
The STOP-AF trial was designed to look at patients who have reasonably straightforward atrial fibrillation, paroxysmal, looking at ablation with the cryoballoon catheter versus drug therapy. In this study, there were 245 patients randomized, 163 underwent ablation, 82 underwent drug treatment. They were followed for a period of 12 months. Over the course of that 12 months, recurrences were frequent in the drug group. As a matter of fact, there were only 7.3% of patients who were free of any recurrence. On the other hand, in the patients who were treated with the balloon ablation, 69.9% of them were free from recurrences or other AF-related problems.
And what kind of complications were associated with the ablation procedure?
The ablation procedure had complications that were quite similar to other ablation reports. Perforation, myocardial infarction, bleeding, injury to vessels. Those were all very unlikely, down in the 0.5% to 1 to 1.5% range. With this approach, there were some phrenic nerve injuries. There were 29 of those out of 228 patients. Over the course of a year's follow-up, the majority of those resolved. At the end of the 29, there were 4 with persisting problems. One of them was symptomatic. So it is an issue that appears to be transient, but it still is something that clinicians are going to have to carefully watch for. I think that the message there is where the balloon is positioned into the pulmonary vein, being sure that the balloon is not positioned too far into the pulmonary vein. The other thing that occurs with the cryoballoon approach is the possibility of pulmonary vein stenosis. That kind of narrowing or scarring of the vessel occurs with radiofrequency energy. It occurs with cryo. It occurs with ultrasound energy. So it's an issue that comes up with all ablations. In this case, there were 7 patients that had veins that were narrowed. 2 of them were significant. 2 of those were symptomatic because of it and required intervention.
And so if this system is approved for use here in the U.S., where do you see it fitting in with other treatments for atrial fibrillation?
This approach has not yet been approved by the FDA. That's something that will occur later on. Once approved, this would be something that would extend the reach in patients with atrial fibrillation. This is something that can be done readily by cardiac electrophysiologists. Positioning the vein is something that has a little bit of a learning curve to it that's important to keep in mind. And it would enable physicians to do this a bit more easily. Right now, one has to ablate point by point by point by point, whereas this does the entire vein all at once. So I think that that will be an important point. That'll be a niche for this kind of technology.
Reporting from Atlanta at the American College of Cardiology meeting, I'm Todd Neal, MedPage Today.